Welcome to the Patient First Podcast. I am your host, Dr. Bryan Laskin, and I'm excited as always to talk about how we can increase the influence of today's engaged dentist. Today, I want to attack a myth in dentistry. It's something that I think is more than a myth. I think it is problematic thinking. I believe that most people who listen to this podcast, most people who are in dentistry, believe that there is a conflict, a tension between being efficient and high quality care. People believe that if you're more efficient, that you're cutting corners. And I say, no. You can actually have efficiency increase the quality of care. How do we do it? Well, we do it by using systems. And I think that we can apply systems thinking through a lot of areas of dentistry where it's not being incorporated today. And when I bring up systems, people probably think of things at the front desk, like financial arrangements or how you answer the phone. That's a system that we have in our practice, which hopefully you do. Hopefully you do. If you don't, it's a good place to start, is at the business office, at the front desk. How do we schedule patients? Where do we put our new patients? Where do we put those longer procedures? Hopefully you have all of those systems dialed in. Easy to do. If not, work with somebody to get that done. It's easy. It's incorporated all over. There's so many great systems. You can hire a number of consultants, many of whom I've interviewed on this podcast or on other podcasts. Hire one of them. They can get that done for you. But what I'm talking about today is particularly clinical systems. Once you leave the front desk and go back in an operatory, do you have things systematized? I would say you should. You definitely should. And I'll talk about why today. And I'll give you an example of one of the systems and also a preview, something that we have at Upgrade Dental that I think can kind of help revolutionize a very important piece of your dental care. So why do we want to use systems in the clinical theater? As James Clem, the great Dr. James Clem says, he calls it the clinical theater. Well, when we're seeing patients in an operatory, we should systematize things. In my practice, we have everything documented painstakingly to how many cotton rolls go on this tray, how many 2x2 cotton squares go on this tray, and we have photos so that everybody knows how to set up the procedure and every step of every procedure. Why? Because it leads to more consistent care. It's more predictable. It's more efficient, meaning it takes less time. And guess what? It's not just about you. If I can have a procedure done at the same level of quality in 10 minutes or in an hour and a half, you think I'm joking. There's many procedures that you can take 10 minutes for that another dentist is taking an hour and a half for all the time. And I would argue that oftentimes that person that's taking 10 minutes is doing it at a higher quality level. Yes, controversial. You disagree with me, write in the comments below. If you agree, subscribe, all that good stuff. But I think that a lot of people in dentistry feel like the person who's going faster is doing it because they're cutting corners. They could be, but they could also just have a plan that they've executed 100,000 times so they know what they're doing, so it takes less time. They're actually getting better results because they've mapped it out. Why in dentistry do we want to reinvent the wheel every time we go to a tooth? Every class 2 composite you do, trying to think of what you're going to do the first step. I hope not, but I think a lot of people do. And they look at every tooth as a snowflake, and every prep is going to be a different experience. And I think why is because people don't understand the value that there can be in having a system that you then incrementally change. So if you have a system that you've done 1,000 times and you think, ooh, this new adhesive, let's say, is going to be better. It's going to be faster. It's going to be more efficient. I'm going to get better results. How do you know if you haven't done it a way that you're just modifying a little bit? I like to call it, this is what it means when we say we are practicing dentistry. What that means is that we are trying to get better each time a little bit better. This is a map for those of you listening on the podcast. I have up a graph of what progress looks like. This has nothing to do with any real skill set, but I just put up what I believe to be the way progress is made in all things. But today we're talking about clinical dentistry. I believe, let's say you start off and you don't know you're very good, so you figure out some systems, you get better quickly, right? And maybe you have a little backslide or you level off. But what happens is we level off. When we do things one way, we're level and we're happy at this level. But if we want to progress and be more efficient or higher quality results in less time, which I would argue is a good goal because everybody wins. If you can get better results in less time, everybody wins. If you can get the same results in best time, everybody wins. If you get better results in more time, then you have to probably take more time, right? But that oftentimes people think that you are getting a better result because you're taking more time. I would argue the fact that no, you are not. So when you hit a plateau of success and you want to get better, you have to make a change, right? And then you get a little bit of jump and then it levels off and then you make a change, it gets better. But these little changes, you can't judge them unless you have a baseline that you're operating from, unless you have a way of doing things. And so maybe you think you have this all systematized, it's in your brain, but it's in your assistant's brain. If you had an associate come in, could you tell them exactly how you're doing it step by step? I would hope so, because I think if you can, that means you have a plan. Everybody's following the plan. We have treatment planning systems. We have all different types of systems, and I would recommend you do too. I think it really helps. And by the way, I should also mention, once you have a system in place, it's not enough. Even the best systems, there's some weird thing about us wired as humans where we want to sometimes do things the difficult way. We don't want to follow the system all the time. So after a while, people drift from the system. So what does that mean? We have to remind people of the systems and remind people of the steps of systems over and over and over again. Even if you do it all day long, every day, remind people. If something goes a little bit off track, people need to be reminded more than they need to be instructed. So make sure you keep those systems in place and remind people. I can't tell you the number of times I just assumed that something was being followed because we had the system. It was documented. Everybody knew. And then I go back 6 months later, I'm like, wait, that's not our system. That's not the way we do this here. So make sure that you have leaders in every division who are repeating the message of how we do things to everybody else in the organization. Obviously, if you have 3 people on your team, one person can remind everybody on the team. But if you have a team with 4 hygienists, 10 assistants, 5 dentists, or somewhere in between, just make sure that you are on track and make sure that everybody's following the systems. I did, however, develop a system that I did a course on in partnership with Kerr Dental, because I believe that one system that a lot of dentists need is an efficient way to prep teeth. I believe that in dentistry, in general dentistry, most of the operative and fixed procedures we do, you can probably prep that tooth in less time and have it be more efficient and higher quality, better results. I don't think using 10 burrs to prep a tooth leads to a better preparation. I think having a system where you're efficient and you have a patient that's less freaked out because this is taking 2 minutes versus 20 minutes to prep a tooth, you will get a better result. What do I mean? Well, I put together this burr block that has 16 burrs that covers basically, I think, every procedure that you will do in operative, fixed, removable dentistry. Obviously, if there's no acrylic burrs, so if you're going to be trimming a denture, you will need a different burr for that. But this is for basically operative and fixed, what you need to do. Now, everything's covered here, and there's multiple burrs and 16 burrs, and most of them have multiple applications. And I go into it in depth, and which ones are single use, which ones I think you can use multiple times, which ones to use where. But I want to just profile, on the purposes of this short podcast, one burr in particular that is an example of a burr that can be used in multiple ways in one preparation. Because I think that a lot of dentists struggle with all ceramic preparations. Just an all ceramic crown. A basic everyday procedure that most dentists are doing, preparing a tooth for an all ceramic crown. In my office, to idealize a prep with no decay, it takes 2 burrs in 2 handpieces. I don't even change burrs. Obviously, oftentimes there's decay, and you have to remove the decay. I use round burrs for most of my caries removal, and then you go back and re-idealize the preparation. But I always start off with an idealized preparation, because then you can get that basic form done. And then you remove or address whatever needs to happen. Let's say there's a fracture on the tooth that goes below the idealized preparation. I ignore it until I get the idealized prep I want to do. If I'm doing an MOD-B onlay, right, I'll do that idealized and then take a look at the tooth afterwards. Okay, it's a tip. Look at the tooth and do the idealized prep first. And when it comes to all ceramic preparations, the burr I want to highlight is this burr. Again, I did this burr kit in combination with Kerr Dental. They have it branded. We can, as we go over the whole kit, but when I start off an all ceramic crown preparation, 100% of the time, I am going to use this burr. The number is C79-023. It's the Kerr Coarse Fixed Grip Friction Grip Egg. You can see it's an egg-shaped burr. And in the center of the burr, the largest diameter is 2 millimeters in diameter. Why is that important? Well, for most of our crown preparations, you want to have 2 millimeters of occlusal clearance so that you can have the 1.5 millimeters for whatever ceramic you're using. If you're using zirconia, you can get a little bit less than that. But a lot of times, like with a lithium disilicate crown, we want to have ideally 1.5 millimeters of occlusal reduction, of occlusal clearance, plus 0.5 millimeter for your bonding. And so that means we want to have 2 millimeters of occlusal reduction. So why do I want to use this burr? Because this is my occlusal gauge. It's also a coarse occlusal egg burr. So I can take off, the very first thing I'm going to do is lay this flat, parallel to the occlusal table, and bring down the occlusal table exactly 2 millimeters, which I know because it's exactly 2 millimeters when I've sunk the egg all the way, right? So easy, fast occlusal reduction, get idealized preparation of our occlusal surface. Now, the next step I do, once I get the occlusal table lowered 2 millimeters, exactly, because I'm measuring it as I'm going. You can make measuring cuts using this burr and then just, attach the lines basically, and you've got a perfect idealized occlusal reduction. Then you flip the burr 90 degrees, go parallel to the long axis of the tooth, and remove the buccal and lingual gross reduction, staying axial to where you want your final margin to be. When I do that, what I'm doing is I'm bringing in the bulk reduction, which can take a lot of time if you're using a less significant cutting burr. Let me put it that way, right? So we can quickly bring in the buccal axial reduction, and then we can move to the next burr, which is going to be one of a couple different burrs where we just go around the tooth and drop our margin. So if there's no decay, if this is an idealized preparation, I only need 2 burrs, my coarse egg, and my axial reduction that also creates my gingival floor or my margin at the same time as the axial reduction. And basically in 2 burrs, you have an idealized preparation, which I walk through in the course. But if you have 2 high-speed handpieces, you don't even need to switch burrs. You've got those 2 burrs in there, you go to town, it takes you less than 2 minutes, and you have an idealized preparation. Now, can you use 20 burrs and get the same results? Yes. Can you use 20 burrs and get more ideal results? I don't think so. I think if you use these 2 burrs the way we've intended, I think you get better results than if you use 20 burrs most of the time. Now, I'm not talking about caries reduction or let's say you want to put in a retention groove or something like that, which I don't for my my all ceramic restorations. You could do all sorts of things, but are you making it better? No. And you're making it more complicated. And when we make it simpler, I think it's more predictable. That's my point. Overarching, simpler is better than more complicated if you get the same or better results. Because if it's simpler, it's going to be more predictable, which by definition is you're getting better results, right? So if you're interested, you can go to upgradedental.com. We have the whole course on the Upgrade Dental prep system. Overarching, however, I want to make sure that I hammer on the point that if you want to get better results faster, being efficient can actually equal higher quality dentistry. And I think it is a good goal to strive for, because we want to practice dentistry. We want to get better each time. And the more clear we are on our systems and the more we incrementally improve, day by day, hour by hour, removing steps that are extraneous and not necessary, and only adding things if they add value, you'll get better results. And so thank you very much for listening. Again, if you disagree with me, please comment below, or like, subscribe, and share with your friends. I appreciate it, and I look forward to speaking with you in the next Patient First podcast.